$100 tip for that.
Yeah, it's like did you tip?
Yeah. That's really great.
Yeah, literally.
Or at least send a letter to their manager or something.
It was the guy next door.
Yeah. It wasn't even your door.
Yeah.
That's really neat. Who he worked for? It's a good story for them now.
Yeah. That's what I told him. Yeah. Easy.
Yeah.
We'll get started in a few minutes, everybody. We're waiting for Councilperson Angelina Hamilton Steiner. She should be here. Okay, everybody. I'm going to call the meeting of the Health and Human Services Committee to order. Our first order of business is to approve the minutes of the November 10th, 2025 meeting. I will make a motion to approve those minutes. Can I get a second?
Second.
Thank you. We have a motion and a second. Any discussion? Hearing none, that motion is approved. All right, our next agenda item is a communication from Assistant Planning Director David Boss regarding the Community Health Action Team, also known as CHAT, the annual report from September 2024 to December 2025. And Mr. Boss, I'll turn that over to you.
Thank you, Madam Chair. I appreciate the opportunity to come in and review our, this being our third report from the work of the Community Health Action Team. Just in terms of, I was going to cover quickly before I hand it over, we've got several members of the team here that kind of cover each of the, some of our focus areas a lot better than I can do. But I think since there are some new folks that on the dais, just a quick kind of background on the Community Health Action Team. Was established after the 2022 Community Health Needs Assessment and Action Plan that was developed. It was a unique effort that kind of combined, we had the representatives here of the key foundations, the schools, the city came together and worked with the Center for Community Solutions to develop the Community Health Needs Assessment, which is kind of a unique thing. Normally, hospital systems do those. The city did it for its residents, and then developed an action plan, which went back out to the residents to solicit and develop interventions towards the needs that came out of that assessment. As part of the review of the assessment and the action plan by council, there was a recommendation and then followed through with a charter for a Community Health Action Team that was stood up. And so over the last several years, we started in 2023 where we initially started to work through the preliminary interventions that were provided through that action plan by the community. It was an awful lot of work analyzing, sometimes combining, sometimes kind of setting aside some interventions into kind of a parking lot, if you will. But over that year, we basically got through all the interventions and organized them into kind of 5 categories that were based on the social determinants of health. And so those focal areas are the same ones that you see today: access to behavioral health, food access. What started as community information and has developed into the resource guide, adaptive programming, and then after-school program we've combined into the same kind of focus area of adaptive middle school programming, and then housing. So into 2024, the chat formed subcommittees, and so we kind of expanded that discussion from the members of the action team to include some key community stakeholders that were identified through the assessment, and really delved deeper into the interventions in those specific areas. We looked at 3 specific kind of directions for the actions that were already being done, who were doing them, who were they done for, and kind of an effectiveness look at those. For those interventions and actions that weren't already being done, why weren't they being done? Were there reasons? Were they not feasible? Was there not an organization to take hold and drive them forward? And then there was kind of a third area that we recognized during the first year of our work was that what was missing from this. Obviously, anytime you kind of go out to the community with a fairly open-ended question, even based on a needs assessment of actions, the recommended interventions, I think we were quick to realize our own kind of gaps and shortfalls within that list of interventions. And so that was kind of the third area that we looked to the subcommittees to try to fill that in terms of what was missing. So those actions and then the work of the subcommittees continued. And now we find ourselves in the last year for 2025 as those things have kind of continued to become more focused, more refined, really into the table that you see in this report here. as well as, you know, the kind of the changing environment that we addressed this past year. There's always kind of turnover in the action team that has happened, but as the work of a lot of the subcommittees has kind of, I guess, kind of been refined and kind of been found new directions and potentially in new organizations and things, we continue to meet to continue to kind of work these things that are in the table from this last year, because it's a unique organization in so far as the chat brings kind of the nonprofits, the schools, and the cities together, which there's not a whole lot of venues that do that to discuss these types of issues across the social determinants of health. And so it has a lot of value for that reason, as well as I think kind of the broader environment this year. There was an awful lot of churn, loss of funding, cuts, uncertainty that kind of entered into the world of a lot of these areas. And so that's kind of, in a nutshell and very quickly, kind of the background context and then the ongoing challenges that we've had this year. And so the crux of this report is to kind of, you know, as it's intended, as an update of the work over the last year of the action team. And so the progress by priority area that we kind of lay out here is really, you know, what's been done in 2025 in each of these areas, and then what's the very general or basic kind of way ahead. And so with that, I will turn it over to our access to behavioral health. Is going to cover that? Is that all right?
Hi, good evening. I'm Kristen Broadbent, CEO and president of Three Arches Foundation, and happy to be here tonight. So the behavioral health, when we first started, it was actually access to healthcare, and you know, found that behavioral health in particular was where more coordination and access was needed, and really we brought providers together who all had some type of footprint in Lakewood, and they were like, they didn't know, like they knew one another, but they didn't really know how to access one another. And so we did two things. We established a healthcare providers roundtable, and then we started an investigation of a co-responder program. And the roundtable was great. I think we had 3 meetings through the middle of 2025. And they were exchanging cards and talking to each other and saying, you know, oh gosh, if you run into this problem, I can help expedite that. The navigation is huge, and so many individuals, you know, our healthcare system is so complex, and especially for somebody with behavioral and mental health issues, you add that onto it, and the stress level, and people don't know where to go and how to access things. There's a long wait for providers. And so bringing these organizations together was really beneficial from their standpoint to understand, you know, sometimes they're treating a lot of the same people and figuring out how to help folks work through the very complex system. So one of the things that the committee spent some time on is working with the Case Western Reserve students to help with the community resource guide, and you know, to really triage it and look at it like in kind of a step-by-step manner of who's involved, at what level, what services are provided, how's access, all that kind of stuff. So we spent a lot of time on that. And then in regard to the co-responder program, the Lakewood paramedic is part of the committee, the healthcare providers roundtable. And so it was we talked a lot about, like, could that be expanded to more of an all-encompassing co-responder program? And would it help to solve a lot of these issues? And so if you sat and listened to what Oliver was responding to as the paramedic, what the police had to deal with, and fire, you know, like the limitations and everything, as well as barriers, it just really made so much sense. So we took it a step further, and we invited folks from the First Call program to come and meet with the group in June of last year. And the First Call program actually was initiated by the mayor of Shaker Heights And very quickly, he got fire and police involved. And then they share a dispatch with a couple other communities over there. So it encompasses 5 communities right now on the east side. And in the report, I won't read the statistics in here, but they've had a lot of great success. And so we heard firsthand from the woman who was the program coordinator about really the strides that they've been making within this program and how it's really become extremely beneficial all around for the individual who is in crisis, who needs the help, for the police, for the fire, for the community at large. And so it was very interesting to hear firsthand perspective.
Kristen, if I may.
Yeah.
Oh, well, back here. In relation to that, for the Department of Human Services, one of the things that's come out of that in response to that in our collaboration with the neighborhood paramedic is that we have brought on a clinical manager now, and we're with some retirements and other things that have happened within our department, we've been able to restructure and realign, and then with some funding, the way our clinical manager, which our clinical manager is essentially the social worker who is over the other social workers in the department. So we've brought Nicole on board, and we are transitioning her from just being over the community-based services team to being broadly over all the social workers and the 18 to 59 range, which is part of kind of this response, because in some of this response and working with, in conversations with fire chief and police chief and all of that, we wanted to be able to have somebody in-house that was readily available if there was a need. And so we're making some changes within our department to allow more flexibility with that. And I'm sorry, Kristen, but I just wanted to share that, we are as a department making strategic changes in how we're able to respond to needs to do something our way, because I think the reflection on some of these learnings from that was that just because it's done this way in one community doesn't mean it's going to work here, because we're unique in that we have a Department of Human Services and a lot of them didn't, and that they were outsourcing some of these response models as well. Mm-hmm. So we've made some changes to help that.
Thank you both. Just to backtrack just a little bit, so that I pull you all into the conversation here. When we're looking at the priority areas from the chat report, the first one is access to behavioral health care. And one of the questions that I was asking the folks in the chat meeting the other day was about the mental health providers with police officers, because we seem to hear that is such a great idea, and I know we've talked about it here a couple times, like how can we actually make that happen? And of course, Kate Ingersoll can attest to, I always want the simple answer, right, Kate, for the very, very complicated questions, like everybody else, right? Can't we just put somebody in the car with them? But there's a lot more to this, and this is what Kristen has been describing here, is there's a program in Shaker where they're doing this, where they're assisting people with mental health issues, as opposed to just sending the police that are sometimes at a loss of what to do with them, right? I mean, they can enforce the law, but if they're not breaking the law, like how do we bridge that? So that's kind of a piece of the background to that, and I'm glad to hear, Laura, that you guys are addressing that and working with the paramedics. I think that's a huge plus there for that.
Yeah, I mean, and we're just at the very infancy of it here as a department, so there's obviously more objectives and goals as we go, but we wanted to make it work within the model that Lakewood has.
Very good. Thank you.
So I also wanted to share as we move forward, and so the roundtable, in full transparency, it was challenging to get the folks from the roundtable to then meet in Q3, and we didn't even try in Q4. As you can imagine, everything that was happening last year, and it was really like a firestorm. And so they're, while they remain interested in this work and collaborating together, they were taking care of themselves first and foremost as organizations. And so finding the right time to bring people together just didn't happen. But I think There is a huge appetite to work collaboratively, and when I worked at Lakewood Hospital, we had a board member, and he said it when we started his Three Arches Foundation, that Lakewood is like your perfect petri dish. And I don't mean that in an icky way, but I mean that in, like, it's a great place because we have so many resources, there's so many people, and we work so well together. It's a great place to try things, right? You have to be able to, though, be okay with the risk-taking involved with that. But I think that everybody, from the roundtable's perspective, the different healthcare providers kind of understood that, and those that have the outposts and are here in Lakewood and doing the work really want to continue to work together. And so our way forward is to work with to transition the behavioral health initiatives to the Department of Human Services as the lead entity. And that just makes so much more sense to, than having us do it. But I think that there is real interest, and I would encourage you all to be open to maybe continuing to look at this co-responder. Parma and Parma Heights is doing it now in a different type of model. But it is something, and when you think about just like the benefits of it, and somebody who is in crisis that doesn't necessarily need, just the way that we handle behavioral health is just needs a lot of help in and of itself.
Right.
And so to just be able to think about things differently, I would encourage, you all to really take that into consideration.
Yeah, thank you. And that's exactly what we're trying to do. Jump into the 2020s from the 1970s, right? With the way that we handle things. Laura, can you touch a little bit, and Director Berry mentioned this a little bit, and it's kind of the elephant in the room with the budget of what is happening with the cuts. And can you talk a little bit about that and what we're seeing so far this first quarter?
Yeah, so unfortunately, just the way of the world, and from the federal down to the state level, nothing's on our radar right now that's going to affect human services beyond the CBS contract. And the CBS contract is our contract within the Division of Youth framework around the Lakewood Area Collaborative Services. And if you're not familiar, or as you become more familiar with this, it's a county contract, and that contract within the county serves not just Lakewood, but the near west 2 zip codes of Cleveland, 44111 and 44135. There's a list of zip codes. The near west, and then also Rocky River, Fairview Park, Bay Village, Westlake. And so we serve that through that contract. And it's important to understand that, because I think as we look at as human services, we look at our neighbors as well. And so it's always been something that was brought on as, we're going to house this here because ultimately I think our partnership with the schools and the services we provide to our community are richer because we have that program. And then we're also serving those near us. But the county is cutting that by 25%. And so, yeah, so it's retroactive. So we've been operating this year. We've been waiting. They still haven't actually handed us any documents to sign. But they told us it was retroactive starting January 1st. So our emergency assistance, all of that. We're very fortunate that we have worked some ways through the foundation and other things too. We're like the only one that's not cutting any staff or anything from that right now. But we don't know what the future holds with that contract. And so that's something that scares, I think, the department a little bit, is, caring for the people in our community and surrounding. So
with these cuts, 25%, is that just to the Division of Youth?
It's specifically to that contract. So it's not, when you look at the structure of human services, you have Division of Aging, Division of Youth, Division of Early Childhood. But within the Division of Youth is also the H2O program. But that's separate from that. This is just the community-based services contract with the county.
Okay. Colleagues?
Thank you, Madam Chair. Do you know what that dollar amount is? And it's okay if you don't have that off the top of your head. I'm just curious.
I think it was 600,000. I think it was like 100. I have it in my email if you give me a moment.
Okay.
So.
If, because after this meeting, we have a finance committee meeting where we're talking about, we have some legislation before us to potentially create a fund for the use of the adult use cannabis funds, and discussion of mental health was one of the elements of that. So it might be useful to have. We don't necessarily need it tonight, but just what that dollar amount is.
By the end of the meeting, I should have
Okay,
it.
no rush. Although I'm sure you would like us to know that amount if we're thinking about allocating it. And then I wanted to ask about which orgs were included in the roundtable.
Sorry,
Or
good
types of
question,
orgs, if not
Sarah. Yeah, so there's a list that I have here. Okay. So it was the Cleveland Clinic Lutheran Hospital, Cleveland Clinic Fairview Hospital, Cleveland Clinic Lakewood Community Health Center, Neighborhood Family Practice, Recovery Resources, City of Lakewood, and Signature Health. And then the schools.
Great, thank you. No UH?
No what?
University hospitals? Okay. Were they invited or they declined? In Metro? I didn't hear Metro either.
I do have my answer.
Yeah.
Sorry, we had someone we had someone that represented all of the major hospital systems during the assessment, and then I think over time and turnovers, people kind of petered out and either didn't follow through with the committee or whatnot, but these are the main folks that are listed. I think that's last year's report that had like all of
Yes.
the assignments as like an appendix to it. You'll see the main people that were in each of those subcommittees, or at least that made it through.
Yeah,
the
sure.
state, so.
And I just didn't know if that was an intentional or just
It
who
was not
said yes
intentional. No,
or
we
showing up as half the.
people got tired of seeing emails from me in 2022 about joining the health conversation. So, but
And then I know you said it was challenging, understandably, to bring everybody together in the third quarter and fourth quarter. But with the sort of handoff to Human Services as lead on this work, is there the idea that we're hoping to continue periodic roundtable meetings, or as a reference point? Is that?
I mean, we're not opposed to any of that, by all means. And we do have kind of like a human services network that meets. I mean, I think we're obviously going to continue to collaborate in every way possible and bring the right players to the table, by all means.
I think, the idea of a quarterly roundtable, maybe even twice a year, or as we turn this over, it might be a good way to bring them together with the Department of Human Services just to understand the department's role and what all they do. With the closing of Recovery Resources, there's a huge loss. There'll be a huge, huge gap in mental health and substance use disorder support. Not only here in Lakewood, but throughout Greater Cleveland. So that's something else too. So as the landscape has changed, with all the changes to SNAP and the impending Medicaid changes as well, I think that keeping that group active would be really, and broadening it would be really beneficial, but maybe not on a quarterly basis. Sure. So. But.
And a lot of those agencies are a part of our Lakewood Area Collaborative, and we've switched those because of this contract cut to quarterly. But a lot of those agencies are coming to our collaborative meetings, and so our staff have those relationships as well. So it's trying to continue to figure out ways to collaborate when most of them are stretched so thin. Sure. So, but I do have the answer for you. I didn't want to give a false answer. So our original budget for this contract, which was a March to a March, and then a county budgeting, was $650,000, and we had two vacant, like a full and a part-time position that were vacant. That when we heard rumblings of this, we paused any hiring within ourselves internally because we didn't want to hire somebody just to lay them off, because our caseload was up so much the last time around. We asked for more in the contract than we had asked in previous years. So by the time we got wind of that, and then hearing some rumblings, we never hired for that position and a half. So the original contract for this cycle was $650,000, and our amended budget is now going to be, when we actually submit it, which we're waiting for the formal stuff to submit, it's going to be $490,000, roughly $873.17. And so the reduction is $159,126.83. So.
Also, recognizing that that is simultaneously happening while referrals from the county are increasing. So it is also the caseload that our current social workers are taking on within Human Services has increased. I don't remember exactly the percentage that was recently shared, but
Yeah.
it's a higher caseload to the point where it's almost unsustainable for current staff. And so it's important just to note that tension, because the county is also, and also many of the referrals that are coming through the county are also more complicated and almost more complex than the service agreement is intended to serve. So it's just an important component to know about the complexity of the funding changes and the care, the way that this is being managed.
We used to respond to referrals probably, within 24, 48 hours. Now it's like a week, just by the time we process through and go. But we're still responding to all. It's taking a little bit longer, and we're not, it could potentially look like, sometimes we would stay with clients longer through a process. So now we're amending how we clinically do their task, what they have to do before we pull them out of our program and stuff. But our clinical manager, Nicole, is overseeing this with great diligence, so.
Awesome. Yes. Councilmember Hamilton Steiner.
Thank you, Chair Strubeck. Okay, so as I see that we're still on Area 1, and I think behavioral health care is probably one of the biggest issues that in our community, and really countywide, especially with the cuts of the county. And so as we look to the transition to Department of Human Services, how will this work? Can we talk through a little bit about that? What type of coordination is going to happen? Is this going to be an information hub? Is there an opportunity to innovate to help connect? Because not only is there a high need of services, there's also a lot of people that are falling through the cracks. So this is happening from when you're in crisis, you get the help, you might get treated, hospitalized, whatever happens, and then after that, once you're leveled off, you're deemed as okay, you're sort of cut off, and there's no other support after that. Then you go back into that cycle again, potentially. But maybe it's not as bad as that first time that you had to be hospitalized, but you're considered like a step down, right? But you're still pretty much on your own because you're not bad enough to be hospitalized. So there's, people that are falling through those cracks. But then I also did not hear, what about our youth? And are the youth being served in this mechanism, or is that something that we're looking to the schools to sort of manage those issues? So I think there's an opportunity to innovate, and as we're going into budget season, I think we really need to take this opportunity to address the needs, to address the gaps, to look at the opportunities that exist, to innovate, and go back to our community health needs assessment, which I do see we're going to go back and do an update to it. But I think there's still some needs that are not being addressed in our community. And I would really like to see us take this challenge and address it. And if that means we have to request additional dollars, we figure it out and we do it, because the county has already told us where they stand on mental health. And I think we need to take them for their word. The county's not going to save us. The state, luckily, is still putting some dollars behind mental health needs, and we know where the federal government stands, right? So essentially, we have the state and we have ourselves to figure this out. So I think I want to challenge us to really look at this and to come up with a solution that works for Lakewood.
Chad and I are continuing to look at the landscape, and obviously we're continuing to work with city departments. I mean, we're continuing to work and collaborate with our city departments as well as other agencies to best serve and look at new programming, look at new options. And I mean, that's part of, I think, why we're looking at our staff now, and as we're able to really evaluate what positions are most important and what do we need to do without cutting services, because we are very fortunate that we do live in a city that does have a Department of Human Services. I mean, we're unlike many others, but our needs are vast as well. So, I mean,
You need another person,
yeah,
at least.
but, you know, we're being very creative with our funding and looking for grants and other opportunities. So I think Chad was spent most of the day today applying for grants and looking at things. So we're being very diligent and responsibly fiscally with what we have.
And I appreciate that, but I also think it's on us as council to put money where our values are and direct that. And I think that is, and I think it's great, right, looking for grants, but I know what the grant landscape is. I work in the grant landscape. So what I'm saying is we need to figure it out and not solely rely on the grants. And if mental health, behavioral health is an important issue and we value our community members and we care about them, we are going to put investments behind mental health and providing those support.
Very good. Other colleagues? Okay, I want to move on a little bit here. We had planned this meeting for a half hour, and I knew that we could probably have an hour conversation once a week for the rest of the year to really just to even dive into your report. But I wanted to really get into the partnerships that we have created and other opportunities. And I wonder, Mr. Walters, if you could talk a little bit about what the schools are doing for food access, and also so points areas 2 and 4, if you could touch on the food access and the middle school programming.
I am able to talk just a little bit about food access more specifically.
Thank you.
And Mr. Walters is the expert on adaptive programming.
Very good.
I will note, in particular, one of the components of this and some of the work that we're doing in the background right now is to look at what opportunities there are around summer feeding programs. The reimbursement structure for that is very complicated, and the administration of it is also very complicated, but we do have an opportunity based on the eligibility of students at Harrison based on the free and reduced lunch program eligibility statistics that we could potentially house a summer feeding program in that area. So it's both around the eligibility within a school and then maintaining that site within a certain radius of where that eligibility is met. There's an application that you submit through the state, and so we have to identify and determine whether or not we'd be able to house that in Lakewood for this summer. And the reimbursement process is very complicated, and so I'm working with folks and the folks at LCSC, the Lakewood Community Services Center, and other community partners have agreed to meet and start to work through to see what that would look like and see what's feasible. So that's evolving on that front. There's also a responsibility that I think that we all have here is to make sure that families are aware of the summer EBT program. So they're called Sunbucks, and that's a reimbursement or an added benefit that the state adds to SNAP cards or is handed to families who are eligible for $40 a month per child in a household. And so that's another way. Obviously, it's $120 over the summer, so it's for 3 months. I mean, most people look at their grocery bills and know how far that will get you, but it is something, and everything that we can do, pulling down every benefit that's available is really important. So spreading awareness about that program is very important, and the schools do a very good job at the end of the year making sure that families are aware of that. And also, the Department of Human Services is doing a lot of work, because one of the major challenges that we have facing our community are the changes in the upcoming changes in terms of SNAP eligibility and work requirements. And so the Department of Human Services, Chad and Laura and Nicole and their team are looking at ways both to raise awareness and also create internally here in Lakewood the opportunity for benefits enrollment and benefits navigation with one of the staff members here. So those are some of the main components. And then looking on as the school thinks about and is planning on redistricting, questions around what that will mean for eligibility for universal lunch programs, and how those could be administered at certain schools that would meet those qualifications would be the next step. So those are some of the ways that we're working on those issues, and I'd be happy to answer any questions on that or hand it on over.
Kate, I wanted to ask you, could you expand a little bit on the conversation that we had about, can't we just give them a loaf of bread and a jar of peanut butter and jelly, and the requirements that are needed, and possibilities of expanding something in the Madison Park area so that they can sit down, which is a requirement, I believe, in order to provide any kind of food for folks. You can't just set out the loaf of bread and the peanut butter and the jelly. You have to actually have a table and chairs. And can you talk about that for a minute?
Yeah, I mean, I will admit I'm not an expert on this. So, but based on the way that the state reimburses for meals through summer feeding programs, because we are an urban district, we have to have a congregate meal site, which means that people have to come and eat at the site. So you have to have both the infrastructure to serve and provide meals, and they have to be eaten in that facility. And then there's a very complex reimbursement process by which you're managing both the number of meals that you're ordering, and then making sure and tracking how that reimbursement, tracking attendance, so that you can be reimbursed for the full extent of the meals that you're providing. So it's just a very technical administration of a program like that. And so then figuring out kind of which entity in the city kind of has the capacity to do that is the challenge that's in front of us right now. So if we wanted to put money in and say, we're all just going to make peanut butter and jelly sandwiches, and we're not going to attempt to do state reimbursement, and we're not going to kind of pull down any of that funding, it would be very expensive, but it could be done. But there's also that infrastructure is in place to ensure that you're meeting, food standards, all of those types of things. So there's a lot of complication around that.
Thank you.
Madam Chair? Am I?
Go to you, and then we'll go to you.
Okay, thank you. And thank you, Kate. So when I was at the county library system, we did summer meal program through the food bank. And that's probably a pass-through from the state to the food bank. Okay, here. Yeah. So, but, and I remember doing all the paperwork to be able to do all those summer lunches, but it was a good program, at least for youth. Is that what we're talking about? Is it specifically for youth? And then has there been discussion with the obvious partner, which would be Madison branch of the library? Because this was something that we, as the library staff, we had little brown bag lunches that we'd hand out and had in the meeting room. And I know they don't normally have food, but that's a whole other question. So has there been discussion with the library, or is that the essential program, and would it be through the food bank, or
the food bank could be the vendor? You select the vendor to do that, and so they would be an obvious choice in that. And so the discussions with the food bank, we'd want to look at that to see about bringing that in. We still need to have an organizing entity in the community that oversees that. So is like the sponsor is the sponsor for that. So we'd have to manage that, and the libraries are often during the summer in many communities, the site where that happens. And so we would ask the library, the policy that the library has is that food is not distributed there or consumed in their buildings. And so we understand that that's been the general policy around that.
Just be on the record that I don't think that should be the policy, but it is. So it is, and I also see we have Kevin Borgencrow from the YMCA here today, and that they also do food distribution, but of course is farther away from Harrison. So, and of course Harrison's also the school's being a partner. But I mean, there's a lot of ways to do it. I just think libraries are such a great place because you have staff who are there, you have kids who are hungry at the library all the time, and so it's nice to be able to say, hey, we'll have lunch here. So.
Thank you. Councilmember Hamilton Steiner.
Thank you, Chair Strubrick. And thank you, Ms. Ingersoll, for being here and for sharing your knowledge with us. So you had talked about, I think it's by definition the universal eligibility, and that's where an entire school gets the free breakfast and lunch. And I think some years ago when we had a conversation, we had talked that there were 4 schools in Lakewood that were eligible or possibly eligible, and is that still the case?
Yeah, I don't have it exactly in front of me, but currently Harrison is the school that is closest to meeting meeting the standard, which is at about 60%, where they would be fully reimbursed.
Okay.
So our other schools, our district, you have to have 40% free and reduced lunch eligibility in order to qualify for universal free lunch across the entire district. Or you can do it through a community eligibility provision, which allows you to do it per school. Our current rate in the school district currently is 38.7%, I believe. And so
that's district-wide?
That's district-wide.
Okay.
So we're just underneath that 30% threshold. You can do it per school, but it's a very complicated, again, reimbursement formula. And so the school is, what it does is it means that some schools have universal access. Yeah. It means that the school has to pick up the differential between reimbursement between the 40 to 60%. So then it's an additional cost that the school takes on for that reimbursement. And it means that you have, in some ways it's perceived as an inequitable service because it's happening at some schools but not at others. And so it means an additional cost for the schools to administer that. And there are certain schools in our district, I believe, that 3 would qualify currently. And so that's the challenge. It would be the Franklin School of Opportunity. I believe it would be Roosevelt, Garfield, and potentially Emerson. So those are some things. I don't, again, I'm not the expert on this. Yeah. And so I don't want to be quoted as the expert, or that my information is binding anybody to any obligations, nor is it in any way an implication of anything that someone has done or not done. The schools do an amazing job of providing lunches, and they do a tremendous amount of work to make sure that every child has access. It requires a tremendous amount of work on the nutrition services program side in order to make sure that families are filling out that free and reduced lunch form, which is really huge because that helps us understand what our eligibility rates are. And those are ways that as community partners, we can all be involved in making sure that we're sharing that information and encouraging families to sign up and get enrolled. But these are the mechanisms that are available to us through state funding, that where you can pull down that funding, and it really enhances that. For a school district to take on that expense on its own is pretty significant, and that would, it would mean that you're taking away from other services as well. So figuring out how to balance that is the challenge, and I see our school district working every day to figure out how to manage food insecurity, both at every school level, and then how to do that. But to, administer one of these programs, building the sophistication to do that, and building the funding mechanisms that would offset the additional costs that we'd be required to take on is really the complicating factor, and is where that technocratic work is really needed.
Yeah, and it's just, I think it's something that we need to continue monitoring, because being right there at that cusp, who knows, in a year could be a lot higher. But I know that there's districts around us that have all, the entire district has been deemed eligible.
Yeah.
And they, and they've announced it, so I'm sure there'll be some more communities that get added. And again, it's not, it's if we are eligible, we definitely want to take advantage of that eligibility. But again, it's not something we're cheering on, because what does that really mean, right? Like, it means that our community is not as healthy financially as we would want them to be. So, so I think I think I would just like us to continue to monitor this situation. I'm sure the schools are all on that. Thank you. Thank you.
Thank you. I did want to have Mr. Walters talk a little bit about the adaptive and middle school programming.
Yeah, I know a little bit more about that than I do.
Very good. Thank you.
The lunch program. So, the two objectives that I was charged with was looking for more opportunities for our community with special needs, as well as middle school programs, and that came out of the survey. But actually, I had done a survey probably almost 4 years ago now, and it mirrored it. There was a concern that there's not enough opportunities here in Lakewood for middle schoolers, and then also for our students with special needs. So we were able to, we actually started off with wanting to do some adaptive swim lessons. We have the two community pools as well as the high school pool. And the challenge was it's not easy to get training specifically in adaptive swim lessons. But we received a grant from Healthy Lakewood Foundation, and we were able to get 3 of our swim instructors trained. We did a pilot program, now over 2 years ago, and it was highly successful. We did a survey at the end, and so now it is part of our seasonal swim lessons. So we're able to provide one-on-one swim lessons for students with the physical or cognitive disabilities. So that's been a nice start. The next opportunity, the Recreation Department was able to partner with Empower Sports, and they provide adaptive sports programs year-round for kids. And we started off like with one session, and now they come to Lakewood because they're all over both east and west side. But starting in January, running all the way through July, we run a program every Monday night, and they play pickleball, and they play football and baseball, and someone would just want to play basketball year-round. It's a fantastic program. I went several weeks ago, and if you're ever feeling bad about yourself, just go there, because there's so much joy and so much fun. And they have a full-time staff, but they also rely on volunteers. So we have some of our staff members volunteers, and also our athletic director has a student-athlete leadership team, and one of their charges is volunteerism. So they've been coming out, some of our high school athletes have been coming out to the programs and assisting. And it's actually been so successful, we've now just added a second night. They call it the Rising Stars program. It's for kids ages 4 through 10. So the program is growing here in Lakewood. When they're not in Lakewood, the people are always asking, when are we going back to Lakewood? So, I can't be more pleased by the growth in it. And I have one little buddy. Well, he's not little anymore. He's 21. But he's always like, I'm going to practice tonight. So I know for a fact he looks forward to it every week. And then the other was looking to get more opportunities for middle school kids. There's a lot of programs through the Metro Parks and through the Recreation Department, but it's really geared for elementary school kids. And then when they get to high school, there's so many things that they can do, from the arts to career tech to athletics and so on. But there's a gap in the middle school. So our spring summer booklet's about to come out in 2 weeks, and I counted 54 programs just this summer. And that, again, it's education, it's the arts, it's athletics, it's just plain fun. And I didn't even count H2O into that. The H2O program in the summer is such a good program for our middle school kids and for our high school kids and college kids that have gone through the program and now serve as counselors. So in those two areas, I feel like we've made some great headway to address that gap. And I'm real excited about the opportunities for our kids and also with our special needs. It's young adults and even some older ones that are still participating. So it's been a real positive experience.
Very good. Thank you very much. I also want to give a couple minutes to Mr. Kevin Bourne-Crow, if you want to come up to the speaker here, the executive director at the Lakewood Family YMCA, just to, if you want to reflect on what you've heard at this meeting today, if there's any opportunities for the city or this chat group to continue to partnership with the YMCA.
Thank you for the invitation. Hi, everyone. As Cindy said, I'm Kevin Bourne-Crow from the Lakewood Family Y. I'm here mostly because I just wanted to be invited to the party. You're all working on a lot of the things that we're doing at the Y, and I met with Kate and Dave a couple months ago, and we talked about chat, and basically that was my response is like, how do I get invited? How do we, find a way of making sure that the Y can show up for the city in a lot of the ways that we're doing currently. So, when I first looked over the community health needs assessment during my light evening reading, really like what stands out to me is how much of the work the Y has been doing for a long time. So, particularly around food access, behavioral health programming, adaptive programming, those are areas that we're doing a lot of work already. Really the one area that at least the Lakewood Y branch doesn't offer is housing. But we have our Y Haven program downtown where we do offer housing. So really there's a lot of overlap with the work of chat and I think, Sarah, you mentioned that the food program we have, we're one of the drop-off locations for Hunger Network. So in 2025, we donated over 15,000 pounds of food just from the Lakewood Y branch. So every Monday, I just unloaded boxes and boxes of bread and produce today. So we get a huge drop from Giant Eagle every Monday. We get several other drops of food throughout the week that we have community members from all over that come and get food from us throughout the week. And that's open to the community. You don't have to be a member to come in and get some free food. The mental health programming that we have, we've just launched a mental wellness program at the Y. So you can come in and do a workout and then see our in-house therapist and have an appointment with him. He offers a sliding scale. He takes insurance. It's a whole legit mental health program. And then again, the adaptive programming, we have adaptive swim lessons, and we're working on some other adaptive sports as well. My son Finn is a huge Empower Sports fan. He's going to basketball tonight, of course. So it's, there's, like I said, a lot of overlap, and I just want to make sure that, as a Lakewood resident, as someone raising a family in Lakewood, I want to make sure that the work that I'm doing professionally also meets the needs of my community. And when I see a lot of ways that we can be doing work together and serving our residents in a consistent and reliable way, that's where I just want to make sure that we're showing up and offering whatever we can do to meet the needs. So.
Very good. Thank you so much. I appreciate that. Councilmember Baker, did you have a question?
Yes, thank you for indulging me, Chair. I have a question for Mr. Walter. And I'm so, the middle school thing is a glaring thing to me, just as a community member, and how we get some of those kids that, they walk in a group down the street and some people are like, oh, what are they doing? And so, it's great that we're focusing, and the Recreation Department is focusing on kind of like programs. One thing that I always remembered as a kid, and you likely growing up in Lakewood might have remembered it, is just open gyms. So the concept of Harding will be open now, pay $1 if you have a Lakewood, student ID card, $3 if you don't. I'm not suggesting that's what we should do, but just some system, and having one rec employee there, and letting. Because I see the benefit of like really rigid programming, and I see the benefit of like free form play, which I think we've lost as a culture and a society, and that's no one here's fault. That's, I think, a lot of, kids are traced with their watches, and parents always know where they're at, and so they don't have really opportunities to explore in kind of like safe spaces. They won't be hurt necessarily, other than maybe playing a sport. So I'm wondering if the district or the rec department has ever thought about, I mean, we have 9 gyms or 10 gyms, staffing, Saturdays at 10 a.m. to noon or something like that, and just allowing, one side could be foosball or whatever, soccer, one side could be basketball, you could do any game, kickball, kind of free form. So I'm just curious if the district's ever look into that and kind of where that would go.
Yeah, and Councilman Baker, I don't disagree with you. I grew up playing at the cage and going down to the ball field and playing just free form. One of the biggest challenge is we have 9 gyms and they're used all the time. You coach, so during the winter months, really in the fall when volleyball starts up, and then into basketball, and then we're just as the season's ending. This is the time of year the gyms are available. Well, you can't tell by outside right now, but the weather changes and then the kids want to be outside. So that's probably you hit it on the head. The gym space is a big challenge. And then the other challenge would be staffing it. I don't feel comfortable having, an event staff oversee it. It would have to be, I would really want someone with coaching experience or a professional educator who can work with kids with various needs. It would be ideal if we had more gym space. I try to remind people that we've lost McKinley, Madison, Franklin, the North Gym, I call it the gymnastics gym. We've lost a lot of gym space, and our programs are blowing up. I think in basketball, both boys and girls, we had a 60% increase in participation in the last 4 years, and the baseball and softball is softball's actually almost 100% increase in the last 4 years. So kids are playing, but it is organized, but that limits our facility availability for some of that free play and open play. But I don't disagree with the thought. And I certainly we can look into when the gyms are available. Friday nights and Sundays are the only times they're available in the winter.
My 9-year-old would love a Friday night basketball from 7 to 8.
Yeah.
And I do think, and not to cut you off, because I appreciate that. The amount of times I hammered Coach Camlock for gym time for 3rd grade travel basketball practice was a lot this summer or this winter. But I do think that even in this, like, you and I grew up in this town, there were a lot more outdoor basketball hoops in the 70s, 80s, and 90s than there are now. So even in the summertime, I think when the gyms maybe would be, the pressure would be less. I mean, in July on a Sunday or a Saturday, I could see my kid wanting to go and play basketball. But staffing is still the issue, and so I recognize that. But I hope there would at least be some appetite to look into that, because I think it would be a great, and it's also, it may open up opportunities for the district to interact with parents that don't have kids in the district, go to other schools and maybe understand the benefit of the schools and, kind of interact with school property in a way that they don't because they go to LCA or they go to Westside Christian Academy or whatever. So just a suggestion.
Very good. Any other quick comments? Mr. Bixenstein.
I want to say thank you all for being here. I concur with my colleagues that if the opportunity presents itself for us to help to fill some of this funding gap, that's I certainly would be supportive of that. Quickly, with regards to the summer feeding program, Ms. Ingersoll, as somebody who's immersed in the Harrison community and gets wind of some of these challenges every day, anything I can do to help with that. I realize that infrastructure is just one of several obstacles, but if there isn't a possibility, it's always possible with the Madison Library with the basement, there's some wiggle room. But if that doesn't prove to be the case, I would certainly be happy to explore other infrastructure as well. In the park, you see it all the time when the security guard will come in with a couple pizzas and have a little pizza party, and kids just swarm like hornets. And of course, the Madison Court Community Coalition is another example. You see the need is really evident and abundant, and so any way I can assist with that, I'm happy to.
Good. Councilmember Keppel, and then thank you.
I'll keep this very on the program, the youth. I think we had to use the technical term would be out of school time and engagement, and you all know that this is an issue that I'm very passionate about. The Troy Mart Foundation, it's all about that time for kids in that age group to have two or fewer nights without something specific to do, and it isn't a lot of times the organized things as much as those are wonderful, but having a third space where middle school kids can go and have potentially entities come in and do things. We have, Colors Plus just moved to Lakewood. We have other organizations, Beck Center, Y. We have all these different organizations, hopefully the library, that could come in and do content program if we had a third safe space where kids, there's no cost of entry, there's no barriers, and that can be a place where there's positive engagement. And so that's something that I'm hopeful that I would love to see continued community collaboration around finding a way to do that. And with that said, I know we've all thrown a lot of ideas at you, and I just want to make sure that it's clear that from my vantage point is like none of this is criticism, it's just enthusiasm for the work that you're doing, so thank you.
Mr. Bullock.
Thanks, Madam Chair. Director Walter, to pick on you a little bit in support of the comments here. So there's limits, but that's not down to zero, right? So there could be space, even with the expanded programming, which my kids happily participate in, to do the unstructured free-form play, assuming that you could staff and budget it. But there are rainy days off-season, so they prefer to play outside, but it's a downpour, so the inside becomes an option. Also, to be direct, it used to be that the school district had more gym and outdoor basketball access. They were taken down before your time, I think, or when you were in a different role. And that's hurt access in the city. The city's done some work, in the community, I should say. The city's done some work over the years to expand that, but we've taken incremental steps. Probably we need to take some more steps, but it would really multiply the options if the schools recommitted themselves to that same access. So that's why I think I'd welcome the chance, and maybe Council President, whenever we have a chance to talk to the school board in a joint hearing, to put this on the agenda. And I'm quite aware that's not a $0 ask, but it's so important. And I think the city has been improving in recent years. Our own investment in the city-owned parks, sports fields, and all that the great rec department that you're a part of programs, and that partnership is improving as it should over time. So I think there's some more strategic coordination just on that side of things. Very briefly, thank you to the whole group, Director Boss, Assistant Director Boss, and the whole team here. Kristen Broadbent, you've been at this for years. Director Walter, everything we're doing on the walk to school, safe walking to school, is right in line with all of the behavioral health. And Kate, you're the guru of so many things, and Laura, thank you for all you do. I'd like to get maybe an after-hours briefing on the county funding situation. Is this permanent? Is it temporary? They probably don't know, but the council president, used to be the finance chair, is Lakewood's representative. We have good relationships with him. Let's get his view on things. it's possible that we could find some interim funding, but I think just to my colleagues, like Human Services was originally begun as we're a service location for county and other area services. So if the state or the county is doing a permanent reduction of their funding level, I hope that's not what's actual. Before we can commit permanent replacement funding, I think we have to understand our strategy. Just as you know, the finance director, the previous finance director used to observe that the every dollar in the city could be taken up by concrete in the engineering department. I'm sure the need is much larger than the budget. Even if your whole budget was restored, the need is greater still than that. So I'm also receptive to supporting, but the piece that I want to also study up on is how do we get our hands around the need, and some of that's inside our footprint and some of that's beyond our footprint. So there's a lot there, so maybe we could talk offline.
Yeah, I do appreciate that, because I think it's not been very clear and it's not been communicated to the council neighborhood, the CNL, the Council of Neighborhood Leaders, which oversees the collabs. Each collab kind of sends a representative to it, and even last week they had a meeting. And there's a lot of it that's just not been clearly communicated, and shame on the county for not really. They've said they were going to make all these cuts, and we've just been waiting and waiting for clear, open communication. And maybe I shouldn't be saying any of this, but it's been frustrating just being in limbo, and I feel for my staff that's under me that they were in limbo and worrying, and they're doing great work. It's hard work every day, what they face, and then to be worrying about what's the future of this position that I've invested so much in, and these families that we help and serve. And so any pressures we can place to get clearer answers and clearer visions for where the future holds, probably the better. So I'm open to any conversation. I know Chad would, obviously Chad will as well. So, and he's more deeply invested and involved just because he's been on that, chairing that group of leaders. So he's very invested, obviously, in that, and knows the players at the table of the other CNLs that are also being affected. So the other collaboratives, I mean, and the whole, just so you understand, the whole idea of the collaboratives, not to derail us, but the whole idea with the collaboratives was really to prevent children and families being involved with DCFS. And so that was the whole thing, is like, let's catch families, let's be in the communities, let's support families. So like if there's a strain on them financially, or there's something going on that can prevent abuse and neglect, that we're getting that before it gets to the point of them being in the hands of DCFS. And so that was the original goal of those. And now, because the county, hiring freeze within even the Department of Children and Family Services, and they're all doing more work than they should be individually, more tends to come down to the collaboratives that maybe used to stay within the case managers there. So if that makes any sense.
It does, and we can follow up, and it's probably a collegial conversation with our allies at the county, and they can probably give us some indications, and at least informally. So happy to work with you on that. Thanks.
Very good. Thank you all for coming in tonight. Thank you for the continued work that you do in these difficult times with limited resources and limited hours. With that, I'd like to make a motion to receive and file this report. Can I have a second?
Second.
The motion's been made and seconded. Any further discussion? Hearing none, all in favor? Aye. And with that, and no further items on our agenda, this meeting is adjourned.
Finance will start in like 5.
Thank you. Thanks for coming.
Thank you. No, yeah. We can, yeah, I'll probably.
I never thought I'd be doing community health.
Locker room.
Yes, yes, yeah, I will email it to you. Yeah, thank you for coming, yeah. Yeah, and then as I answered that question, I'm like, capital L. Did I have that conversation with you, or am I had it with E? Because I think Anne works with, she works with Steve, and she was the one that was looking at the yeah. Oh, there, okay. Yeah. Yeah, and she's also a great resource. I mean, she's been here and stuff too. Yeah, so she's actually a very good resource. Yeah. It is, and that's hard, and that's where it's. That's all right. Everything's okay. Yeah.
I didn't even know she was here. I know.
Like, I'm thank you.
Dave, all good?
Yeah.
I feel like, yeah. Are you in the, mine's worse. Mine is worse. No. Yeah.
Early.
I had Ohio State winning the first game. One time I picked them and they disappointed me. How's Michigan going?
Yeah, her and they're pregnant.
No, Michigan, their sisters. I think I'm kind of paying attention. And, well, I'm one who accuse it. And Jessica, I think they enjoyed my 1 year. My 1 year. So he should know. He's below me. Oh, I'm right there with you. Yeah. Yeah. Yeah, Jessica said, she goes, what is she? Age. Thanks, Jessica. Yeah. I was kind of in a real hurry. It doesn't matter. Like, does it matter?
I knew that it was just ordaining myself to be in last place. I couldn't get
Thank you. Spring, it's the spring. I'm trying to bring in the warm weather, but it's not working. note in Granicus today about adding some other language. You could have like right back to that. Oh, well, it would have been 19.
I will go ahead and call to order March 23rd, 2026 Finance Committee. The first order of business is the review and approval of the March 2nd, 2026 Finance Committee meeting minutes. Without objection, they are approved.
I was ready to make my big motion.
Well, I stole your thunder, Councilman Bullock. I apologize. The next order of business, we have two docket items, of which we covered in our last meeting, but we wanted to sleep on it a little bit before we came back. So the first one is Ordinance 15, 2026, which is the ordinance to create the Host Community Cannabis Fund, enact Section 12965 of like codified ordinances. As introduced, it had some language, and then on the floor at the last meeting we discussed some additional language that I believe is reflected in Granicus as a substitute. And there may be further amendments on that. But I guess to start the discussion off, I will move to substitute the ordinance with the substitute that is in Granicus.
Second.
The motion's been made. Second. Any discussion? All those in favor say aye. Aye. Okay, so now we have the substituted version. The one thing, so Councilman Evans couldn't be here, but he did send me a thoughtful note in advance. I think he's dealing with allergies or he's a little under the weather. Is sometimes, you know, I as a member of council, I have a good idea of the purpose of our funds, where the money that goes into our funds come from, and the general purpose that those monies are then spent, because it's dictated in our codified ordinances and in law. The one thing is I don't always have great clarity, and perhaps if you go through the budget book, you could find that clarity of like what specific things the funds from a specific fund are spent on. I should stop saying fund. What specific things the money from the funds are spent on from a line item perspective. And that's one thing that Councilman Evans brought up, and I was wondering if there's an easy way. So this question to the finance director is, would there be a way over the next couple of years for the finance department to provide a communication to the docket at the end of each year that kind of outlines where this money was spent in a more limited nature and not like kind of segregated from the other funds?
Are you meaning specific to this fund?
To this fund, yes.
Well, the definition would be in our AFCR, sorry.
So for the uninitiated, could you describe what an AFR is?
It's our yearly financials, and there is a list, I believe there should be a list of every fund and what their purpose is in that. And I mean, yeah, I'm happy to give a report to council on the specific fund if you wanted annually.
Yes, because I understand, and that's my level of knowledge of our funds. We have many restricted funds, and I read through and I see balances. And then sometimes when I go into the Board of Control, I can see where money comes from for certain projects. But then the collation is where I miss some of it to see actually where, you know, like kind of a true up of a particular fund. And I think this one is of importance to the community. It's a new revenue source, so I think some mechanism to see that from a reporting standpoint, whatever we do to the language in exhibit or in subsection C as far as what the authorized expenditures are, Any comments from my colleagues on that point? Councilman Bullock?
Thanks. You're saying not a prospective, but a year-end or a look-back reporting period to say what were the actuals?
Yes, and why I propose that is because this is a new source of funds. So I think it would be helpful for us as the appropriators in the city to see where these new funds are going. And then potentially that could inform some future decisions about authorized expenditures, right? Is there money sitting in there because it can't be spent, or do we see it's going more towards a certain subsection of the authorized expenditure? So we want to think about that from a policy perspective.
Certainly. I mean, that's I agree very much, and I think that probably is a healthy practice for all funds, for all spending now. But to take this first step, I'd be happy to support a request or a requirement. I suppose, Director, would a simple communication be enough? This could be a standard practice for at least this fund.
Sure. Yeah, that's no problem. I would just ask. I haven't seen the Granicus. Could you scroll it up just so I can see the change? I can't see the bottom
You
of it.
scroll to the.
Yeah. Oh yeah, section C.
Mr. Chair.
Yes, Councilman Bullock.
Unless you were in the middle of a thought, I've got a point to build.
Always in the middle of a thought, but not a particularly insightful one.
Great. So, okay, no particular. There might be a couple of corrective amendments to include. So I'm supportive of the spirit of Councilwoman Strebig's proposed changes here. I guess the committee has accepted the changes. Might capitalize them.
Yeah, to be clear, they were accepted to then form the basis of our discussion. So we'll open to other amendments.
So first of all, I think it's a good change. So in section A, we say there's hereby established a capital projects fund. Okay, so then we jump down to section C. Now we're talking about public health and safety, and then, you know, I think that's the tracks for me: complete streets, ADA transition plan, and Lakewood community health capital needs assessment implementation. Well, I should. Big N needs assessment implementation, but isn't Lakewood community health needs programmatic as opposed to capital? So that's an issue to consider or address. So that's number one. Number two, just as an observation from my colleagues, you know, I do think in our budgeting we could improve by being strategic and giving ourselves periodic, whether that's annual or some other time basis, check-ins on our use of funds, just as the chair is talking about. Another example is the NOPEC funds. NOPEC funds have been doing great programs for quite some time. They've been doing the same program for quite some time. Maybe they should, but maybe they shouldn't. What we typically consider, though, is a piece of legislation proposed by the administration that assumes that we are going to continue the use of those NOPEC funds for what we've been doing with them for 10 years. And I think, as you know, part of the decision-making at City Hall for the use of resources, from time to time, I do agree we should be asking ourselves, hey, let's check our assumptions. What might we make resource prioritization decisions around and for? So last little comment for me on this. So this is a new source of funds that's great. I do think we originally envisioned, when this was medical marijuana, a public health component. More recently, we've expanded the expectation around both complete streets and ADA implementation. So these are all great. Should we be thinking about these funds as new improvements or to backfill longstanding needs? So we just had an important conversation about county cuts, at least for now, to important mental health services. It certainly could be a worthy use of these funds. that could all swallow up every dollar for 20 years. Now, if we want to make that decision, we can have that discussion. I don't know how I should be thinking about this. I'm just kind of putting that question out there on the table, because these are new funds that could provide a strategic opportunity to do some new things to meet some new needs. So to me, that's what's exciting about the creation of these funds, and thank you to my colleagues who put this piece of legislation forward.
Yeah, and I think to that point, thank you, Councilman Bullock. I agree with what you're saying, and we may make, I may propose an amendment to make it a fund, not a capital projects fund, to address some of the concerns you talked about. Would that, from the law director standpoint and the finance director, is that what we need to do?
Yes, Mr. Chair, thank you. We were having the same discussion. We can always say other capital improvements and operations related to accessibility, equity, wellness, and human services, just to bring that scope into this.
Yeah, so where do you propose that language at? In section C? I'm talking about section A that says,
yeah,
there's hereby established a capital projects fund. I'm wondering if we just put established a fund.
I can show you my drafting.
Okay.
Mr. Chair, it's exactly what you just said.
Okay. Okay, so that first thing, I will make a motion to delete capital projects from subsection A. Motion second, is there a discussion? All those in favor say aye.
Aye.
Aye. Okay, and then the next thing, Councilman Bullock, I think that's why this reporting is so important. And that's where, and I often, sometimes when I'm really bored, I read the Lakewood codified ordinances and establishment of the finance department and our charter and all those things. And if we ever wanted an analysis of a fund, we simply would just put a communication on the docket saying, hey, what are we spending out of the DARE fund? There's a DARE fund.
Or you could just email me.
Yeah, that too. I'm a lawyer, so we do things. Director Vargo knows.
You could email everyone on council then.
But so we have those rights. I do think in this instance, this is unique in the sense that it is new revenue, and we are putting some outer bounds of how the funds can be spent. So I think we want to know how they were spent and how it impacts the rest of the budget, and then how we may refine the boundaries of the allowable expenses, I think, from a policy perspective. So if the finance director will commit, I think we could put this in text of the ordinance. I'd prefer that we just got, kind of commitment on the record that the next 3 years we'll get some analysis of it and a communication on the docket at the end of, March, when books close. So we can see and then refer to committee and have a discussion about it, I think would be very helpful. Would that be something that the committee wants or be helpful?
Yes, Mr. Chair, from me, the timing might need some thought because we go into budgeting for the next year earlier than March. So we'll be doing a March look back of the previous year, but we'll already be in the cycle for the current year, which we would have started really around Thanksgiving. So if we figure out the timing.
Well, one I guess to Director Mahoney, one would be a time that you feel like you could adequately drop a communication that and be ready to discuss in committee kind of where these funds are going.
Well, it would be part of the budget document.
The budget document is, this is where you're technically correct. But I think that there is a benefit in a separate discussion aside as it relates to this particular fund.
So maybe as part of the budget discussions in the fall, how the money, I don't see us spending too much of this year, to be honest, but, as part of when that section of the budget comes up, an analysis of, I think that probably would be the best time, because then if council wants to direct the funds specifically for the next year, that probably would be the best timing. So along with the budget discussion.
Yeah, I'm almost looking for a look back as it yes, because I do think that it will be included in the budget. I mean, we're here till midnight, and no, when we do the budget, and it's also year end for me and my day job, and Christmas shopping for kids, and it's probably the most stressful time to be on council is during the budget season, and so sometimes I think we lose forest from the trees. And that's why I'm proposing more of a look back. And as we saw this year, we can always amend the budget. We've done so many times to Director Mahoney's chagrin, I think. So it's possible for us to do that. So I would suggest after, because this is more of a prospective or a look back, so that we can then think about how we want to, because at any time we can change the authorized expenditures, right? So that's where I think after the close of the year. Councilperson Keppel.
Thank you. Yeah, I think there's kind of two things, because we're just creating it this year to understand the timing in some ways. And then we've also talked about trying to have an early start with council priorities and working with the finance department prior to going into the budget book creation. So that would be a time also to be looking at, as Director Mahoney mentioned, since these funds were not necessarily anticipated in our 2026 budget because we didn't know if and when we were going to get them. As we heard at the last committee meeting from Director Berry, and at the meeting right before this one from Assistant Director Jaisley about the needs in human services regarding the mental health due to the county cuts, if that was something that we wanted to use, that they were used on this year. So I feel like this year is sort of maybe a year to establish the best practice and discover it together a little bit, is that if we won't necessarily have a look back too much. Maybe we will, in which case we'd want to hear about that from Director Mahoney. And but if we are thinking as we're heading into our budget priorities and getting those with finance, that would also be a time to be like, hey, have you used any of this yet? And then maybe in the next year would also be a look back of how were they used last year? How do we want to use them this year? If that makes sense. So that timing, and we need to work that out with finance, but prior to the budget book creation, we had talked about having those council priorities and more communications. That might be a time to do both things, if that makes sense.
Yes. So what, I think what we're asking for, Director Mahoney, is a distinct communication on the cannabis fund that's separate from the budget. And so if you can commit to doing that and having those conversations, then I think I am comfortable. So is that fair? Okay.
Sure. And actually that, you had originally mentioned March, April would probably time up with what I had suggested, council priorities to be starting to be communicated in June. So if you get the report in March or April on cannabis funds, then you could include that in your council priorities discussion in June.
And then at this point, I will take comments on C, which is really the meat and potatoes of this. So as you can see, the proposed amendment, which I believe was formed by Councilperson Streebig's kind of additions. Any comments from the committee on that? Councilperson Streebig?
Thank you. It could have been my typo, it could have been a clerk typo, but the N in needs to be capitalized, and Lakewood Community Health Needs Assessment, which is a specific document. And then also right after that, because that document is actually exactly what it says, it's an assessment. There's an additional document that goes with it that is the Lakewood Action Plan that then takes us into, it says exactly here on the last page, is moving from assessment to action. And I think that's where, to your question too, Mr. Bullock, this is where we start to get into like more specifics on what are we looking to fund as opposed to just ideas of funding. So I'd like to make an amendment to my amendment And after assessment, add "and Lakewood Action Plan implementation."
And as well as capitalize the end.
Thank you, yes.
So there's a motion to have it read, "and Lakewood Community Health Needs Capital Assessment and Lakewood Action Plan implementation."
Correct.
Okay, so the motion has been made. I will second that motion. Any discussion? All those in favor say aye.
Aye.
So now that we have this, I do think that this is, we're kind of building the plane as we're flying. The state decided to be magnanimous and send us the money, which is good. But I'm interested to see where this goes, because I think Councilman Bullock brings up some good points about, does it just go into the giant, do you put water in the ocean, or are you going to try to fill a vessel somewhere for a particular need? And this might be too broad. We might need to tighten this up, or we might need to expand it. So I think we don't know from a policy perspective. Any other thoughts before we, Director Vargo?
Yeah, thank you, Mr. Chair. Director Mahoney and I are discussing, and I have to apologize.
Okay.
We're not specifically knowledgeable of the community health needs assessment. I apologize, but here's my question. The prior committee meeting that we had, and we've heard from Director Berry at Human Services about the mental health needs and the cuts from the county. To support Human Services on those issues Director Berry spoke about, and the assistant or the associate director also spoke about, are we talking about one and the same thing, or do we need to add what Director Berry was talking about?
So I would think that public health and safety and the Lakewood Community Health Needs Assessment would cover it, and the addition that Councilperson Striebeck made would cover that. But welcome. From a legislative intent perspective, it is intended to cover it. Whether the language does or not is another question.
We could get into the, Mr. Chair, we could get into the chat, which is directed out of that needs assessment, that group that came out of that needs assessment and their annual report. I mean, we could get that detailed, but I think if we say for public health and safety issues within, including complete streets, right? Including these specific documents, right? Not solely, right? Including these documents that we are identifying at this moment. And then, like, to your point, Chair Baker, maybe we need to expand that further next year. Maybe we need to add more plans in there. But I think at this point, it captures the essence of what we're looking for with health and safety related issues within the city, including these things.
Spoken like my legislation.
Thank you. It's a good question that the law director and the finance director raised. It's a technical document. It's on our website. It's done every 5 years or thereabouts. I'm looking right now, and I don't know if the council clerk is calling it up also on, there's a never mind if you're doing something else, sorry. There's a 2022 version of the document, and it's a global assessment, and it includes mental health along with behavioral health and nutrition and physical activity and safety at home and safety at workplace. And so it's pretty comprehensive. Those things used to be conducted by Lakewood Hospital, and I think in the closure of Lakewood Hospital now the city's taking on. So I'm in a long way of agreeing with my colleague that I'm pretty sure that it will capture all the work that the Human Services Department does.
Thank you.
Is that a fair statement from some of my colleagues?
Yeah, I think maybe not every single thing that they do, but in the specific discussion of the lost revenue from the county in order to provide the mental health services, that was specifically mentioned in the report tonight and in the work of TAD. So And the public health language there, but we do need to still take out the capital improvements.
You know what, I thought about that. Thank you for that. And I do think that it could be, it says including, and then it includes capital improvements. So the including qualifies everything that, so I actually think it's okay, but defer to the
First of
law
all, thanks for the explanation of the assessment. That's sufficient for Director Mahoney and me, and certainly your statement of intent is good. It's fine. We are good with it. And if capital improvements stays as because it's just an inclusion, that's fine. Maybe just to eliminate any question about Director Berry's use of some of these funds, even though it's in the including clause, we could say, and other capital improvements and operations related to those items.
Yeah, so I'll make a motion to include and operations in between capital improvements and related.
Second.
Motion is made. Any discussion? Clerks love us tonight. Councilman Bixenstein.
This is more just a question. I agree with the assessment that this should serve the purpose with the change we've made. I know in a lot of times when you see this sort of verbiage, you see including but not limited to. Is that redundant in this case to add that? I mean, is it implied that it's not limited to just by saying including? I guess more of a question and a clarification as opposed to suggestion.
I'm here for it, though, Councilman. Let's make the lawyers earn their billable hour for this interpretation.
Thank you. Through the chair, you see including but not limited to everywhere in legal documents, even though it's true, it's verbose. Maybe it stems from the fact that one time lawyers drafting were paid by the word. But,
some still are. But yeah.
So it's not necessary, but it is certainly standard to have that language. So I leave it to the committee.
Being concise shows respect to your reader. So I'll say let's not be verbose.
Yeah, works for me. Thank you for the clarification.
Any other thoughts? I think we have a amended substitute currently before us.
Did we approve that motion? We may not have. Do we have a motion on the floor?
We do. And so the motion on the floor, you're right, Councilman Bixenstein asked a question about it. So is there any other questions on the motion to add and operations? No? All those in favor say aye.
Aye.
Aye. So now we have an amended substitute that I think we're ready to refer out favorably to full council. I will make a motion to favorably refer the amended substitute ordinance 15, 2026 to full council.
Mr. Chair, I got one question before
Yes.
the motion. So now, as written, I understand what's authorized, but how is an expenditure actually made and approved? So right now, as written, does this require any further legislation from council, or does this read such that the finance director may, at the finance director's discretion, use 1 cent up to the full balance for any named authorized purpose?
Actually, no, I'll need another amended appropriation ordinance, so I can file that with the county.
Okay.
So that was my question. Do you want me to have that prepared alongside this, so council would approve the fund and establish the fund, and then right after, also the same night could be to appropriate the funds from the fund?
Sure. Yeah.
Okay.
I won't be here on the 6th. It's our spring break, but
Might not be here either, but
So,
Jessica will be.
Mr. Chair, thank you, Finance Director, for clarifying that. That makes sense. So that then gives us an opportunity to follow through on and make some self-aware, explicit decision by in partnership with the mayor and council together, say, okay, we now have a fund, we now have some priorities for the fund, and there's dollars in the fund. What do we want to do in budget year 2026 with those funds? And I don't claim to be ready right this moment to say that. We've got a couple possibilities, but and it sounds as if the administration is eager to try to at least partly alleviate the financial deficit in human services. Is that an accurate statement?
I'm not totally clear on the dollar amount of that, so I'm not eager to do anything until I know the dollar amount.
So I think it's a good idea to have a vehicle ready for us to have that discussion, but not suppose that we know the answer to it. That's just my opinion. I don't know if other council members have more clarity about the use of these funds in year one. And last point for me, we have 750,000 or thereabouts. Does that represent 2 or 3 years worth of revenues going
it's
forward?
about 16 months, if I'm remembering correctly.
So that might also shape our thinking. In other words, do we try to obligate all of those funds right away? Do we hold some to be a strategic reserve? And then what's a sustainable rate of expenditure on an annual basis? So all those things. I mean, I'd welcome the discussion. What I'm really trying to do is challenge myself and all of us to think this through one step at a time and be thoughtful. That's
Yes, and we're getting a new dispensary and another one's closing. So does that affect, taxes? I don't know. Yeah. Yeah. So Standard Wellness is moving into where Harry Buffalo previously was, and then the Rise dispensary is moving out. There still will be 2 in Lakewood, but a bigger one, square footage-wise, will be on the west end. So I have the motion on the floor to favorably refer. Sounds like we will get a companion appropriation. Motion is made and seconded. Any discussion? All those in favor say aye. Aye. Okay, the second order of business is ordinance 27, 2025, which was to repeal. Actually, we may need to change that language a little bit of repeal, since we have determined that we might want to change the language a little bit. Because we discussed last meeting the intention to basically make the Finance Committee the Audit Committee, and have a Finance Committee hearing where the auditor and the Director of Finance would be available to answer council's questions and present the audit to council. But we wanted to sleep on it, think about it. Also, I think our edits were new to the Finance Department, so I wanted to give them time to think about it as well. Also, the Law Department. The substitute version, I think, is in Granicus. So, and I think, did I make a motion last time, or do we have to get this substitute in? To substitute, okay. So I will make a motion to substitute what is in Granicus with the changes that we discussed on the record at the last meeting. The motion's been made. Is there a second?
Second.
The motion made. Second. Any discussion? All those in favor say aye.
Aye.
So now that the substitute is in, it's up on the screen. So basically it, still has the establishment and purpose of the Audit Committee. It says the membership is just the Finance Committee, and then outlines, that by communication, the Director of Finance will provide the audit at least annually, and have the independent auditor available to discuss in a public meeting. And then, it doesn't need bylaws because the Finance Committee already exists and has outlined its purpose in the code. So it just has the general rules of operation and outlines what the intention is. Any thoughts from my colleagues about this?
Mr. Chair,
Councilman Bullock?
maybe you change repeal in the opening title to amend. So if you go all the way to the top.
Yeah, I will make a motion to amend the substitute by removing repealing Chapter 162, amending Chapter 160.
Second.
Motion made, second. Any discussion? All those in favor,
Aye.
say aye. Aye, okay. Then the amended substitute, clerks love us tonight, ordinance is now before us. Director Mahoney, I know we talked about this a lot on the floor at our last meeting, but is this acceptable for process?
Sure. The only comment I would have is that often at the end of an audit, it's usually myself, sometimes the auditors do, but it's usually myself, sends out a communication whether or not an exit conference is desired. I think this is in essence the exit conference. And often after a few years, people say, we don't need an exit conference. So I don't know if you want to use that word, the exit conference, or I mean, this makes it mandatory no matter. And I'm fine with that if council's fine with that.
Yeah, I mean, we have an audit every year, right?
Mm-hmm. Yes.
And I know, and by the way, I think I speak for all of us when I say we're thankful we are recognized as elite in the state of Ohio, and that's under your leadership and previous directors. And there are other peer communities that haven't had an audit in multiple years, which is amazing to me.
No, every city has an audit every year.
But
Or they don't get that award, if that's what.
Well, no, I think a neighboring community to the east side has had challenges with their audits, and they have not been completed multiple years in a row. And so I, want to commend your department, but also, the code is for our successors, not necessarily for us. So I'd like to, my intention here is to kind of codify the best practices. And I think that even if we don't call it an exit, whatever you just said, exit conference, I think that it can be implied that that's what it is, and the nomenclature might change in the future. Any other thoughts? Councilperson Keppel?
Thank you. Yeah, I think that's right. And some of our previous conversation too was part of the idea is, we hope it's a relatively, no offense, boring conversation, but that,
It's exciting.
Yeah. but it is, I think part of this is also just, we talked about previously is instead of having, maybe an audit committee that might meet on a Tuesday afternoon with no one around, that if we have it in a finance committee, it's recorded, it's broadcast, everyone has the opportunity to see that level of transparency, and any members of the public that wanted to see it or come and provide public comment or ask us questions once it's docketed would have that opportunity. So I think it's a good practice, even if it might not seem totally necessary given our current, our longstanding good work from the finance department, but it's a good best practice just to show our work.
Sure. Fine with me.
Great. Any other thoughts? Then I will make a motion to favorably refer the amended substitute to full council for approval.
Second.
Motion made, second. Any discussion? All those in favor say aye.
Aye.
Aye. With that wonderful bell and no further matters that come before the Finance Committee, this meeting is adjourned. Thank you.